good. That's a good reason to miss it. All right. Good evening, good afternoon, good morning, whenever, wherever you're watching this live. This is the voice and the face of Dr. Tolu Olabintan, CEO and co-founder of Livingspring Family Medical Center here in the amazing city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. I'm very excited to be on today with a return guest, Dr. Alicia Shelly. Doc, how are you? And thank you for coming.
I am doing wonderful. Thank you so much for even having me to come back. I really appreciate it.
Yes. I enjoyed the first one. Our guest did, and so we thought let's do this again. Yeah. Let me see. Those of you watching live, I don't want to forget #live. Those of you watching replay, #replay. Please comment, give feedback so that I can give you a shout out and address the questions that you may have on this live. Now, with that being said, Doc, can you kindly introduce yourself? Who are you and what do you do?
Yes, ma'am. So my name is Dr. Alicia Shelly. I am a board certified internal medicine and a diplomat of the American Board of Obesity Medicine. I'm also the host of the podcast Back on Track, Achieving Healthy Weight Loss podcast, where we help people with not only getting back on track with their weight loss, but staying on track. And so we're really happy to be here today. I love helping people. So not only am I a podcast host, but I'm also a speaker where I can help inspire and kind of help people with getting back in their health journey.
Also, I knew you were going to downplay. I knew you were going to downplay talking about yourself. So I'm gonna help you a little bit, okay? So she's also done Ironman championships, like tournaments. She's done that. She's a very big exercise buff. I love watching you go for harder and harder milestones in your staying healthy journey. She's also a big time speaker. She's been on CNN. She's been on Fox 5 News. She's been on radio shows. She's been in magazines. I knew she was going to downplay this. I can't even say. And she was named an honoree of the 2021 Atlanta Business Chronicle's 40 Under 40 Award. All right. She's reading a book. I mean, she keeps, man, you're amazing, Doc, and I'm honored to have you here.
Thank you so much. Thank you for, it's so funny that you, thank you for sharing and just picking me up.
Well deserved, Doc. Well deserved. Now, for those of you who are watching, today's topic is, Doc, I had bariatric surgery and I am starting to regain the weight. Help me. Mm-hmm. And so, Doc, that being said, why do you do what you do? Why do you do what you do?
Yeah. So the reason why I really want to help people is that I struggled with my weight since childhood. So this is something that has been an issue for me. And like some people, I would go up, I would lose weight, gain it back, lose weight again, gain it back. And so it was just always a struggle. It was never ending. And eventually I underwent bariatric surgery in 2015 because I'd gotten to my highest weight and I really needed help with kind of getting down. I just couldn't, everything I had tried just was not working. Mm-hmm. And so with the bariatric surgery, I was able to lose 80 pounds. But then several years later, it started creeping back up again. Life got in the way, stress got in the way. Before you know it, I'm 40 pounds regained the weight. And so, and it was, I have to admit, that time of regaining the weight kind of hit me a lot harder. Because I had done everything possible prior to this, and I went bariatric surgery, and in my mind, I thought that was it. Like, I did bariatric surgery, this is it. Going normal BMI, and we're done. But that wasn't my story. That wasn't what I had experienced. I actually I'm still not a normal BMI. So I realized it's just not for me. That's not my, it's not. I have a broad shoulder, so I'm an Amazon woman for sure. So, but the goal is, can I be healthier? I changed my tune to be more healthier. And so, needless to say, when I realized I'd gained 40 pounds of it back, I was ashamed. I was devastated. But I then committed myself at that time that this has to be a lifestyle change. This just cannot be like just some diet where I do for like a couple of weeks, a couple of months, lose weight, and then that's it. I go back to as if nothing had happened. This has to be what I do on a daily basis. I need to make a change. And so what I ended up doing was I went back to my physical trainer, Oh, actually, not went back. I joined. I signed up for a new one, and then I started watching what I was eating. I started actually trying anti-obesity medications to kind of help. Eventually, the weight started coming back down. It wasn't until I started with the Ironman training is when I really saw a change, because that was just so that's such a strenuous activity. But needless to say, I think you asked me, why do I do what I'm doing?
Yeah.
The reason why I do what I do is because my story is not unique to me. There are people who are suffering with the same thing. And so if I can help you, if you're feeling like you've gained the weight, or you're just frustrated in general with your weight loss, I want to tell you that it is possible to overcome it. It is possible to kind of move forward. You just have to take it one step at a time, focusing on the small goals and staying consistent. And even if you don't see the weight loss that you want, because we all want to lose 10 pounds in 1 week, but it just never happens that way.
Right.
We never lose weight the way we lost it when we were in our 20s.
Right.
That's when you stop eating pizza and you're like, oh, I've lost 10 pounds, But now it's like we're older, we got to work at it. It's more to it. And it can be overwhelming, but I want you to know that it is possible, that you can do it, and to stay encouraged.
I love it that you're living the story. You're living out what you're trying to empower other people to do. And so you can relate to some of the pain points and you remain motivated. I don't know how you do it. But I've watched your journey, and I've enjoyed seeing you stay consistent. And we'll talk more about that as we go on. Now, my next question to you is for someone who is watching, like, what's the usual cause for regaining weight after bariatric surgery? Is it that it stops working, or what's, generally speaking, what would you say?
Oh, so there are multiple reasons why people regain weight after bariatric surgery. One of the things is hormonal imbalances. So right after bariatric surgery, your ghrelin hormone, or your hunger hormone, starts to decrease, and your leptin hormone, which is your satiety hormone, the hormone that tells you that you're full, increases. But when we look at people who have bariatric surgery, those hormones are switched. So now you have a higher level of ghrelin hormone and a lower level of leptin hormone. And so a lot of times people are feeling more hungry. They're not feeling satisfied, and they're wanting to eat more. And so sometimes when you're overly hungry, you just grab what's available. So sometimes you're grabbing foods that are high in calories. You're drinking, sodas or drinks that are high calorie but low nutrient value. Sometimes, because with the bariatric surgery, it decreases how much you can eat. So you may eat a little something, but then maybe an hour later you're hungry again. So, you may find that with that, you're grazing throughout the day. And you may also be grazing on high calorie foods like chocolate bars, or things that kind of hit that dopamine, that make you feel good but aren't necessarily good for you. Other reasons why people gain weight is because sometimes life happens. They have some physical inactivity. One study showed that when they looked at people after weight regain, like 24% of them were physically active. And so a lot of times we get overwhelmed with work. We have work obligations, family obligations. So sometimes it can be very difficult to find that time. Like, I don't know about you, but time seems to be going by too fast. Look, I needed to slow down. I'm finally in a good place in life. I needed to slow all the way down. But it's always something, always something. So sometimes that can be a case. The other one too is, let's talk about the elephant in the room. Sometimes you can go through a depression. You may be going through a hard part in life where, it's just overwhelming for you. Sometimes we may not have been diagnosed prior to surgery, but sometimes people have what we describe as binge eating disorder, where they can't. It's hard to do it a lot with the bariatric surgery because you're vomiting up, but sometimes you're binging and eating as much as you can, and then you're just full and you feel ashamed. And so sometimes with those different eating disorders, that can also play a role and sabotage you as well, especially if it's when you're in an emotional roller coaster when these things flare up. But last but not least, you have your anatomic surgical failures that can occur, where you're having either like an outpouching. Like, some people are like, oh, my pouch is distended, and it's not going to be as tight as it normally was right after surgery. So for those who have bariatric surgery, the best time to lose as much weight is within that first year. But it's normal for it to expand some. But it's not. It becomes too much if you have like a complete outpouching. So there are multiple reasons why this happens, and it's not just one thing. So it's just trying to have that individualized approach to it.
Okay, so let me ask a question that someone is asking in the audience right now. Let me see. And they're saying, I can cut out a lot of foods that I enjoy, but I enjoy food and it brings a certain joy. I can relate to that. So you talked about the dopamine release with certain foods. How can I continue to lose weight after I cut out cheese and pizza? So maybe the question is more like, how can you still enjoy the dopamine release, like really enjoy your food and help yourself lose weight at the same time? Like eat your cake and have it is essentially what we're asking. What would you say to that?
So the one thing I would say is try to avoid kind of restricting yourself from things. The reason why I say that is because it gives it like this desire. Now, I'm not saying that those are some things you should cut down, right? You shouldn't be drinking sodas, but I'm not saying that if you drink like one soda or even a mini soda, that's not going to mess with your weight loss, right? Because it's just one particular drink. But it's kind of what we do on a daily basis that makes a difference. So, for example, even though, and I'll talk about the example of pizza, right? If I'm eating pizza multiple times out the week, it's going to definitely put a role because it's extra calories that I'm taking in, and then I may not be able to burn as much, right? So that definitely can slow down my weight loss. But if for some reason I can turn that same pizza and make it healthier, right? I can actually, instead of buying that pizza from Domino's or buying that pizza from Pizza Hut or wherever, I can make a pizza more healthy at home. I can still have that cheese, but it's not as much cheese. It's just something, it's small enough portions that I can be able to enjoy it. Now, I'm not eating it every week. I may eat it maybe once a month or, once 2 or 3 months, but I'm not necessarily depriving myself from the pizza. I'm just limiting how often I'm frequently with it. So like if I have patients that sometimes are going to a birthday party and they're freaking out like, well, what can I eat? Well, number one, you can kind of bring healthy foods to yourself. But if you're looking forward to that cupcake, that one cupcake not going to bring you down the rabbit hole.
Right.
It's just one cupcake. And if you still feel upset about it, you can cut it in half, share it with somebody else, but then enjoy that cupcake. And then next, go back to your eating habits. So sometimes when we deprive ourselves from different foods, and first of all, it puts like it puts them on a pedestal where it's like, oh, I can't have that, and so we want it more because I don't know about you, I want stuff that I can't have. But if I'm like, well, I can have it, but in moderation. Or let's say, for example, I like fried chicken, right? So I can have fried chicken, but what if I air fry it? Or what if I bake it and put it with breadcrumbs and I make it myself versus going to Popeyes? Like, so you can be able to find healthier ways to substitute, but it not be something that's hindering your weight loss. Because, I say this a lot, especially when we talk about Thanksgiving and Christmas, where you have these big meals, and everything, cake, 5, 10, cakes, pies, all this type of food. And people are like, oh, it was Thanksgiving that did it. I was like, Thanksgiving is one meal. And you could have, taken what you wanted, small portions, and eaten it, and then next go exercise and then be done. But what we do is we take that food and we have it for like weeks on end as leftovers. So sometimes there's ways how we can be able to approach that, where instead of saying, oh, I can't have it, being like, well, I can have it, but let me change it to more of a healthier option, or let me limit how much I'm exposed to or eat of it and then go with something else. So I hope that helps.
Yes, that's a wealth of information. And I like how you mentioned you could have a healthier version of some of the foods we like to indulge in. And it's a question of what you do consistently, not just the one-offs that make the difference. That's a good one. Now, my next question is would you say you've noticed that those who have better follow-ups with their bariatric surgeons after, like, do you have any advice on that? Like how soon after the surgery should you follow up with or how many years after? Do you still keep following up with your doctor, a primary care doctor, to prevent weight regain? Where does your primary care doctor or the bariatric surgeon come into play with all of this? What would you say, Doc?
So some bariatric surgeons will allow you to go back to your primary care and have your primary care each year, kind of check your vitamins and things of that nature. But there are other bariatric surgeons who want to see you as a patient every year, especially after your bariatric surgery. So once you get after bariatric surgery, you are still like, not necessarily, they have you coming back at a certain interval. But after that first year, they may have you coming back once a year, or they may have you coming to see your primary care. So it just depends on the person, on the surgeon itself. But at least if you have, and it just depends on the surgery. If you have gastric bypass or a sleeve gastrectomy, it's going to be once a year after that first year. If you have the biliopancreatic with duodenal switch procedure, that's going to be every 6 months after that first year. Okay. And so it is important to sometimes follow up with someone about this, because one of the common complications from bariatric surgery is vitamin deficiencies. And it's just because the fact that you are rerouting the gut and the stomach, you're not absorbing as much of the nutrients and as much of the food. So it just sets you up for having like low vitamin D, low vitamin B12. So it's important that you're being checked at least once a year for the gastric bypass and the bariatric surgery, and then every 6 months for the biliopancreatic with the duodenal surgery. After the first.
Awesome. I wanted to highlight that because a lot of times, you've done the surgery, lost the weight, yay, I'm good, deuces. But that follow-up is very important to make sure that you're still on the trajectory to keeping off the weight loss, or at least not increasing it significantly. So following up either with your bariatric surgeon, your primary care doctor, your specialist as needed is also very important. Now, my next question to you is this. Let's talk weight loss medicine. We're not going to go into a lot of detail because of time. And of course, these are medical suggestions. We do advise that you make an appointment with your own doctor to come up with a plan that works best for you. But for someone who's watching, like, all right, I had bariatric surgery and now I've gained some weight and I want to try medicines. Is that an option for me? What would you say to that?
Oh, yeah. So there's some research looking at bariatric surgery and medication after, like, with weight regain. And they found that it actually is successful in helping people with losing weight. I've had patients who had bariatric surgery and they regained the weight for multiple reasons. And we put them on medication and they were able to kind of get down to a healthier weight. So definitely it is an option. You would need to speak with your primary care or your weight loss specialist on what would be best for you.
Okay, awesome. Good answer, Doc. Thank you. Now, my next question is this: are there resources? So because you do a lot of Google searches here and there. For someone who says, I've had bariatric surgery before. I need a support group or resources for someone like me because I'm not someone who has not had bariatric surgery. So my case may be different. Are there support groups or resources for people who have had bariatric surgery that you recommend?
Yeah. So definitely with your bariatric surgeon, they tend to have support groups. Okay. And the people who are in these support groups are people who are going to have the surgery or people who've had the surgery. So sometimes you can reach out to them and ask for support. The other thing is that in your bariatric surgery office, they usually have a dietitian or somebody who can kind of work with you and provide support. I would recommend maybe seeing a provider who's a specialist for obesity medicine, just because they have the knowledge and they'd be able to kind of assist you and help you with the support you need. I can't say there are multiple Facebook groups, and I won't say which one is best, but they do have Facebook groups where you can be able to have more support and people who are going through the same thing.
Okay, awesome. So there you have it. You have resources through your bariatric surgeon. You have resources through your physician that does offer obesity medicine care. And then also talking with a dietitian too can be another resource for you. All right, this has been very, very, very helpful, Doc. I really, really appreciate you. And I have people who are watching who are like, man, how can I follow her? I see that she's someone who could help maybe keep me motivated. Just watching her story inspires me. Doc, where can people find you, either to have you come speak at their platform or to just watch your work and be encouraged and inspired on their own journey?
Yes. They can actually find me at Dr. Shelly MD. I'm on everything. Facebook, Instagram, TikTok. I have something for you. Also, feel free to actually look at my podcast, Back on Track, Achieving Healthy Weight Loss Podcast, where we talk about how we can live more healthier lives and lose weight healthy.
Back on Track. I'm going to make sure that we put that on so people have access to that. Let me just make sure. I see your Facebook and your Twitter and LinkedIn here. That's awesome. And then your Back on Track with.
And the one thing I would say too is coming up next week, we have somebody talking about bariatric surgery as well, Dr. Kalina Pebble. So feel free to check that out.
Oh, awesome, awesome, awesome. So I'm going to make sure we put that in the comment section. If I don't do that live, we'll do that afterwards so people can tune in. Her show is amazing. She has amazing guests, and she gives a lot of helpful tips to help you in your weight loss journey and in your health journey in general. There we go. We got it. Back on Track. Yes. DrShellyMD.com/podcast. So I have it down on the screen. If you're watching on Facebook, YouTubers, just give me a second. We're going to post it too. So you have that too. There we go. We have it there. Thank you so much, Doc, for coming. I appreciate you. I know you're busy, and I appreciate you taking time to come on here.
I know. Thank you so much for having me. This has been a lot of fun.
All right. Awesome. 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 Thank you all for watching. As always, please share. Caring is sharing. So tag people. I see some of you tag people in the comment section. This is awesome. You can also simply forward this video to them. And if you and someone you know is looking for an awesome, a thorough, and a passionate family physician who will have conversations like this to help you live long and well, I am she. Have a good one, everyone. And thank you so much, Doc. I appreciate you.
Thank you.